So, Dr. Rajneesh, what is fatty liver and why is it so common nowadays?
Why it's common? Because we know that the overall prevalence of diabetes and obesity is increasing worldwide. It is told that almost 830 million of people are affected by diabetes.
So, can it exist without any symptom as such?
Yeah, Dr. Amitabh, most of the fatty liver exists without any symptoms. It's incidentally diagnosed.
A regular ultrasound can detect this fatty liver?
Yeah, regular ultrasound can detect fatty liver, but it cannot.
Fatty liver is untreated or if the health is ignored, can they actually progress to cirrhosis of liver or liver cancer? Food should be avoided by them so that the fatty liver stays under control or it will be avoided in high risk people.
Yeah, the foods which commonly we tell is to avoid sweets and sweetened carbonated drinks. Second is processed and ultra processed foods, including processed meats.
The good news for someone who is drinking. Namaste everyone, welcome to yet another episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a platform where we try to simplify complex topic with the help of experts. Today's topic is something which is quietly increasing all over the world over last 1 to 2 decades, fatty liver. Now many times fatty liver is identified incidentally on ultrasound report and most of the time people disregard it just as an incidental finding. But is it the fact? Many times we blame it to alcohol intake, many times we blame it to something else. Now, what exactly is fatty liver? I am very happy. I am joined by Dr. Rajneesh Rajan, who is an experienced gastroenterologist and has seen countless number of fatty liver patients and treated them. He is going to clarify what exactly causes this. Should it always be blamed to alcohol or are there any other risk factors for this? Should you be ignoring it or you should be regularly monitoring this over the period of time? He is going to clarify all these doubts in today's podcast. Thank you, Dr. Rajneesh, for accepting our invitation and sharing this information today with us. Dr. Rajneesh, can you tell us something about your background?
First of all, thank you for having me, Dr. Amitabh, and I appreciate your efforts amidst busy schedules to conduct this academic podcast.
It's much needed nowadays, yeah.
And best wishes.
Thank you very much.
Myself, Rajneesh Rajan. I am working as a specialist gastroenterologist in UAE for the last 7 years. Before coming to UAE, I worked in India as a specialist gastroenterologist for almost close to 7 years. So that's my background.
And what all diseases are you treating here as a gastroenterologist?
No, gastroenterology is a vast area. Like it'd be dealing with solid organs and luminal organs. Luminal organs like food pipe, stomach, intestines, colonic issues, and solid organs like liver, gallbladder, pancreas, and other organs. So it's a vast plethora of cases we deal with.
So we are very lucky to have you here. So whether you are the patient whose ultrasound identified fatty liver or any of your near or dear ones is having fatty liver, this episode is definitely going to add knowledge to your existing information. So Dr. Rajneesh, what is fatty liver and why is it so common nowadays?
So in simple terms, we say that the normal liver cells is replaced by fat. That is basically fatty liver. Why it's common? Because we know that the overall prevalence of diabetes and obesity is increasing worldwide. It is told that almost 830 million of people are affected by diabetes, and WHO says that the expected amount of people having diabetes by 2050 is in the range of almost like 1.3 billion. So rising obesity and rising diabetes mellitus are the main cornerstone behind rising fatty liver.
So many a times it's a common misconception probably that if there is a fatty liver, it is linked to alcohol intake or drinking, excessive drinking. So is it always due to that or it can happen even without alcohol consumption?
Yeah, 100%. So when we talk about fatty liver, it's basically fat occurring in the liver's normal liver cells. It can be either due to alcohol, it can be due to non-alcoholic condition. Non-alcohol means most common is diabetes mellitus, obesity, hypothyroidism, and also in certain scenarios where medications induced fatty liver can also occur.
Now you mentioned about obesity and diabetes. Now it's almost like a pandemic, it's growing every day, the incidence prevalence is increasing day by day. So how does it happen because of diabetes and obesity? the fatty liver?
So the basic reason why people with obesity and diabetes mellitus develop fatty liver is insulin resistance. So the body is unable to utilize the available insulin, which leads to excessive deposition of triglycerides in the liver from the abdominal fat, which can also lead on to excessive free fatty acids and inflammation. So thereby it increases the chance of fatty liver.
So coming to the same question, diabetes and obesity. You say it happens equally, or maybe we don't know more than alcoholic. Does it happen in almost all patients who has diabetes or obesity, or only if it is an uncontrolled one or very disproportionate obesity?
It's a risk factor actually. We can say that classification. So we in this aspect we need to see the classification. So we stratify according to the risk factors. So risk factors means definitely the duration and the uncontrolled diabetes and the duration of the diabetes and the grading of the obesity does matters actually. So as the number of risk factors increases like age, duration of diabetes, uncontrolled diabetes, grade 3 obesity and other metabolic parameters like cholesterol issues, like high bad cholesterol in the blood, high uric acid, hypothyroidism, everything. So when we assess the risk factors, we can risk stratify whether it is low risk or high risk categories which can progress to liver disease. So when fatty liver we are discussing about patients who are prone to develop liver disease due to fatty liver.
So viewers, please understand fatty liver, as Dr. Rajneesh clearly said, it need not be just due to alcohol consumption, but there are many more reasons, many more commonly prevalent reasons like obesity and diabetes. The incidence of these two diseases are increasing globally, but no need to worry for all the diabetics and obese people. Only when you don't take charge of your health, if you don't control your diabetes well, or if you ignore your obesity or continue to ignore your lifestyle, healthy lifestyle, that is the time when it can happen in your liver. Now, Dr. Rajneesh, frequently it is seen that it is incidentally detected. So we go for ultrasound of something else and for some other reason, and then fatty liver is detected. So can it exist without any symptom as such?
Yeah, Dr. Amitabh, most of the fatty liver exists without any symptoms. It's incidentally diagnosed. So the ultrasound report shows either a grade 1 fatty liver or a grade 2 fatty liver or a grade 3 fatty liver. Then the patient is being directed to us to evaluate further actually. That's the usual way patients comes to us. There won't be any symptoms. Occasionally people tend to have some mild pain in the right side of the upper abdomen because of the liver enlargement. They tend to have some mild vague discomfort, fatigability, but patient tend to have symptoms of other concomitant factors. But patient can have symptoms of diabetes mellitus, patient can have symptoms due to morbid obesities, patient can have symptoms due to sleep apnea and all those things. So that's the way they come to us, and then we diagnose fatty liver based upon ultrasound and lab parameters.
Yeah. Now you said grade 1, grade 2, grade 3 also may not have any symptoms at all, and it is incidentally detected. So that's also very, very important point for our viewers, that even with grade 3 fatty liver, many a times the fatty liver may not be showing any symptoms. So then which are the first or early signs for this fatty liver, which patient or the common people who are at high risk, whether it is diabetes, obesity or heavy alcohol consumption, they should be looking for?
Yeah, before going to the warning signs, I would say that this grading of the fatty liver is basically a purely radiological grading. Okay. So it's based upon the ultrasound finding, we grade it like grade 1, grade 2, grade 3. We cannot say that grade 1 is a mild variety or grade 3 is bad variety.
Okay.
Yeah, so we need to evaluate the patient. We need to risk stratify by assessing the blood parameters, by assessing the FibroScan, by assessing the patient in toto. So we cannot tell a patient that, okay, you are having a grade 3 fatty liver, so you are going to have liver disease by this end of year. Nothing like that. No, we cannot tell like that.
Understood.
Now coming to your question, symptoms, we should not miss the symptoms produced by the reasons behind fatty liver, like diabetes. When patients tend to have high increase in weight gain or increase in sudden weight loss, or a tendency to drink more water, or tendency to urinate frequently, and easy fatigue. By the time they come from the office, they feel tired, fatigue, overall a gloomy feel, overall low mood. So these sort of things can lead on to, this can be the symptoms by which we can say that people tend to have an underlying fatty liver disease.
So there may not, you mean to say there may not be any specific liver related symptoms. These may be just the general symptoms for which he may visit a physician, and then this is identified.
Yeah, liver related symptoms can occur in advanced liver disease. So the fatty liver actually progresses from pure fat to condition called as steatohepatitis, then to liver disease, and then to liver cancer. So this is the progression. So when the progressive liver disease occurs, people tend to have symptoms like swelling in their limbs, people tend to have fatigue, easy fatigability, overall tiredness, loss of hairs. So many factors happens when they develop advanced liver disease.
Yeah. You partially answered my next question. That was my next question. And whenever we hear about the liver disease or chronic liver disease, there are two diseases which comes into everyone's mind. One is cirrhosis of liver, and second is liver cancer. Now, if fatty liver is untreated, or if the health is ignored, can they actually progress to cirrhosis of liver or liver cancer?
Yeah, 100%. So the data says that if fatty liver is untreated, almost close to 40% of the patients can progress to advanced liver disease in the next 13 years. So this is the data they
That's
saw.
a big number.
Yeah, that's a big number actually. And depends upon the stage. So this is, I'm talking about a plain simple fatty liver. Suppose advanced fibrosis, they can progress in a faster state. So they can progress like a simple fatty liver can progress in 25 to 30 years, whereas an advanced fibrosis can progress to cirrhosis in about 5 to 6 years as well.
Okay.
And any person of an advanced fatty liver disease, the chance of liver cancer in them is almost close to range of 2 to 13% per year.
That's a big number.
That's a big number.
Considering the volume of fatty liver, definitely we are probably sitting on a complex problem which may explode in future time. Now you said grade 1, grade 2, fibrosis, this, that. Now how is it identified?
Yeah, in simple terms, I'll tell you like a freshly made halwa. Like it looks like a soft jelly thing, and you got a lot of fat. That's what we call as a fatty liver. We keep that halwa over maybe 3 months or 1 year, it becomes stiff.
Correct.
So that exactly happens for liver. A fat has been submerged inside the liver, it becomes stiff, then produce a liver disease. So this is in simple term the progression of liver disease. And what all contributes to that is an uncontrolled diabetes, poorly controlled obesity, and other metabolic syndrome factors like cholesterol issues, hypertension, hyperuricemia, and hypothyroidism.
And is it detected with ultrasound? A regular ultrasound can detect this fatty liver?
Yeah, regular ultrasound can detect fatty liver, but it cannot define you which stage of fatty liver you have. For that, we need to do a specialized scan called as a FibroScan to assess that.
FibroScan, and that will tell us the fibrosis as well.
Yeah, FibroScan, a good quality FibroScan will tell you two aspects. One is a fat score, we call it as a CAP score. Second is a fibrosis score, which we measures in kilopascals actually. So based upon that, we can stratify patients into low risk and high risk. In addition to that, we usually do a calculation called as FIB4 index. In the online, you can write FIB4 index like FIB4 index, where you calculate patient's age, LFT, liver function parameters, and platelet count, and you analyze the risk and stratify the patients according to the FIB4 index.
I'm sure the place where you are working, it's the FibroScan is available, but is it easily available in most of the facilities?
It was not easily available until the latest guidelines came in 2024. Now most of the facilities are getting FibroScan because now it's a mandate to screen for any patients with a diabetes or pre-diabetes or obesity with any one single risk factor. It's an indication to do a FIB4 index, and if the FIB4 index is above 1.3, that's an indication to do a FibroScan to assess the liver stiffness.
Yeah, this is very, very important information you have shared. Thank you, Dr. Rajneesh. Now, once we identify someone with a fatty liver, whatever grade is there, whatever fibrosis is there, how important is diet in reversing fatty liver?
Yeah, the most important and the
because
most
most of the risk factor which we see, whether it is a metabolic, diabetes, obesity, all these are somewhere linked to diet. So how important is diet in
the most important and the most difficult thing is the diet in
most
in clinical
easiest and most
practice.
difficult?
Yeah.
Easiest to tell and difficult to follow. Yeah.
If you ask the literature, I would say Mediterranean diet is the diet prescribed for overall benefit, like whether it is cardiovascular, prevention of Parkinson's disease, Alzheimer's, prevention of fatty liver, everything, like overall mortality benefit also, Mediterranean diet is the dietary recommendation.
So diet will definitely
Diet will
tend
definitely,
to reverse.
yeah.
So even losing weight by any means, it will help in controlling the fatty liver progression or the severity of fatty liver.
Yeah. So in people who are like overweight, obese, 3 to 5% of weight loss has shown to reverse steatosis. That means that simple fatty liver. And even up to 10% of body weight loss can lead on to reversal of fibrosis. That means that advanced liver disease can also be reversed by weight loss. And there are studies which shown that people tend to be normal weight, like not overweight or obese. If they tend to lose around 3 to 5% of weight loss, they tend to have an improvement in the overall fatty liver score.
Yeah. So following healthy diet and losing your weight is definitely going to control or prevent the initiation of fatty liver. So then for weight loss, so many injections are available nowadays, GLP-1 agonist and all. So are they actually recommended for fatty liver in such cases then?
Yeah, they are now currently recommended as a treatment modality for weight loss, especially in patients with morbid obesity, sleep apnea, and type 2 diabetes mellitus. So there are large trials. We call it a synergy NASH trial, where they used tirzepatide, the most commonly prescribed medication called as Mounjaro, and they shown to about 55% of the people has shown resolution in biopsy proven fatty liver disease. So that's like a path-breaking finding, and now it's been recognized as a treatment modality to control diabetes mellitus and obesity.
So you mean to say this particular agent, GLP-1 agonist, is already included in guidelines treat such sort of fatty liver, and should it be an issue with insurance in that case, because that is the common issue with the GLP-1 agonist? Yeah.
So in that, the terminology is also very clear. So there is no liver targeted treatment using GLP agonist.
Correct.
So GLP agonist should be targeted to the reasons behind fatty liver. So that means treat diabetes mellitus, treat overweight or obesity along with associated risk factors.
Correct.
So things are very clear when we have to use GLP agonist. Not all persons with fatty liver should take GLP agonist as a treatment of choice.
So yeah, no matter what is the case, you should be losing weight and you should be following the diet. So Dr. Rajneesh, then frequently patient must be asking for someone who has developed or is at a risk of fatty liver, which food should be avoided by them so that the fatty liver stays under control, or it will be avoided in high risk people?
Yeah, the foods which commonly we tell is to avoid sweets and sweetened carbonated drinks. Second is processed and ultra-processed foods, including processed meats. Third is highly unsaturated oils like palm oils and transaturated fatty acids. So all these are considered as junk foods, and it has got a strong risk factor in developing fatty liver as well as progression of the fatty liver. Not only that, there is a concept called as a food insecurity, where there is a lack of access to quality food to provide a healthy lifestyle. So that is one of the most common reason now portrayed as a reason for fatty liver disease. So we all know that as we go for a more healthy food, then it's more expensive and difficult to access. So that's also should be kept in mind regarding choosing the right food options.
Maybe increased prevalence of such foods or easily availability of these foods is increasing the incidence of metabolic syndrome all over the world.
Yeah, but junk foods are easily available and low cost. So that's the reason why we are having a rise in fatty liver incidence right now.
So viewers, please understand, most of the food or habits which Dr. Rajneesh has mentioned, everything is doable, everything is clearly we are actually something which probably we should be following on day-to-day basis, whether it is consumption of sweets, excessive alcohol, inactivity, sedentary lifestyle that is causing weight gain. So most of these suggestions which he has just narrated just now are doable by each and every one of us. So it will not only help someone who has fatty liver in controlling the disease, but someone who is at a risk of developing fatty liver, it will, these habits will definitely help in preventing development of fatty liver in this case. Now you told us, Dr. Rajneesh, which is a common complaint for all our patients, you tell us not to eat so many things. Then what should we eat? So is there anything specific they can eat which probably we can say it as a superfood for these patients? Is there anything like that? If yes, yeah, you can tell us.
In single word, I can say that a low carbohydrate diet, which is included in a Mediterranean diet. So a low carbohydrate Mediterranean diet would be an ideal choice. There are no superfoods, but there are studies which people found that drinking around 3 to 4 cups of coffee, black coffee, unsweetened black coffee, tend to reverse fibrosis in fatty liver disease, tend to prevent the progression of fatty liver disease, tend to prevent hepatoliver cancer in patients with advanced liver fibrosis. So there are many studies on
so this
black
is
coffee.
the good news for someone who is drinking black coffee Americano, but don't drink it in excess to get some extra benefits. So thank you Dr. Rajneesh for this. Now since metabolic syndrome is another reason for fatty liver, can exercise help in a patient who has fatty liver even if they don't lose weight?
So the current classification of fatty liver is basically metabolic syndrome associated fatty liver disease. So I don't want to confuse the general public, so that's why I'm not using that terminology. So for easy practical purpose, we use alcoholic fatty liver and non-alcoholic fatty liver. So metabolic syndrome means the person is either diabetic or pre-diabetic, obesity counted as a abdominal circumference above 94 centimeters in males and above 80 centimeters in females, associated with any of the risk factors like a hypertension, impaired fasting glucose, elevated LDL or reduced HDL or elevated triglycerides. And these are the conditions by which we should be careful regarding presence of metabolic syndrome, and fatty liver are the one which should be careful. So exercise definitely help. Why? Because there are studies on exercise where they found that a moderate intensity exercise around 150 to 300 minutes per week has shown to improvise fatty liver, and a vigorous training almost like a 75 minutes per week has also shown to have the same improvement. So these are the benefits of exercise, because if you ask me, muscle is the closest friend of liver. So that is why resistance training has got a significant impact in improving the fatty liver. So 2 sessions in a week amounting to almost 60 minutes of resistance training has also shown to improvise the fatty liver disease as well.
So this is very important again, moderate exercise as well as some sort of vigorous exercise, as Dr. Rajneesh mentioned the duration clearly, that will also help in controlling fatty liver, preventing fatty liver if you are at a risk for that. So are there, like, frequently patient comes to us, someone who has fatty liver, I'm sure first thing they will ask is what is the medicine for fatty liver. So is there any fatty liver medicine, or it is just the lifestyle changes which we just discussed just now?
Yeah, there is one single medicine which has been approved by US FDA in March 2024. Okay. The medicine is called as resmetirom. So the issue is like it has been advocated not for all fatty liver. It is only for the advanced fibrosis like F2, F3. We call it as F1, F2, F3, F4. So in F2, F3 fibrosis, people have taken this resmetirom. There's a large trial called as Mastro trial, and they found to be 30% improvement in the fatty liver disease.
Okay. So we
but
have
rest of things are basically towards the therapy towards the reasons behind fatty liver, basically control of diabetes, control of obesity, like that.
Yeah. So it is not, we are not just targeting fatty liver, we are targeting the reasons, and the reasons can be anything: diabetes, obesity, or any other which we just mentioned. Now someone who is identified with fatty liver and suppose if his blood test for kidney, liver function test are relatively stable, should he be worrying? First of all, that is one, or not? And second, how often he should be getting a checkup done for fatty liver? What sort of checkup do you recommend in these?
So, as I told you previously that the FIB4 index we used to check for all patients with fatty liver. So, when we check that FIB4 index, if it is less than or equal to 1.3, we tell the patient to have a screening every 1 to 3 years time frame. That the time frame they used to do screening. But if they have some components of metabolic syndrome like diabetes mellitus or cholesterol issues or uric acid or hypothyroidism, then the frequency of blood test they can undergo is once in 3 to 6 months time frame to assess the progression of the components of metabolic syndrome. But if the FIB4 index is above 2.67, then they becomes a high risk, like 1.3 to 2.67 and above 2.67. We used to suggest them to do a FibroScan first, and we see the FibroScan results. If the fibrosis score is above 8 kilopascals, then they will be put under a close surveillance once in a year.
So it all depends on the severity of the fatty liver. Less severity is more the duration should be extended. But if it is a more severe, then maybe more frequently you need to. Now, one important question almost I think everyone must be asking, is it reversible at any particular stage? Is the fatty liver, once it develops, is it reversible or not?
100% is reversible actually. Even up to advanced fibrosis is completely reversible.
Okay, so even if it is a late stage or whatever it is, and if you take the proper precautions with relation to diet, metabolic parameters, weight, it will be reversible.
Yes, reversible.
Yeah. So that's a very, very important and very reassuring advice from Dr. Rajneesh. So one last question for this discussion. What is the one advice you would like to give someone either who has fatty liver or someone who is at a risk for developing fatty liver in future?
I would suggest that a diet and lifestyle modification in the form of regular exercise. I would say that it's easy to search for a gym rather than search for the medications.
So that's very, very clearly advice that work on your health to avoid medicine. Thank you, Dr. Rajneesh.
Thank you, Dr. Amitabh.
All these exhaustive discussions, and thank you for simplifying it for everyone of us to understand. Now, this was the end of main discussion, but we have one more session in our podcast series, and this is rapid fire or one line questions. So, are you fine with it?
Yeah, fine, it's fine.
Yeah. Alcohol or non-alcohol? Which fatty liver do you see more?
You see more non-alcohol fatty liver.
Non-alcoholic. So, don't blame everything to alcohol. You are also at risk. Fatty liver, reversible or irreversible?
Reversible, completely.
Very, very good to know that. Ultrasound or blood test? Which do you prefer first?
Blood test.
Blood test you prefer first. Now, this is, just tell us whether this is true or false. Fatty liver always causes symptom.
False.
False. Yeah. So you can have fatty liver without any symptom. If fatty liver had a warning sign on the body, where would it show first?
I would say skin. There will be like excessive darkening of the skins. Like these are the findings where which you can easily.
This is interesting. What works best? Lifestyle changes or medicines?
Lifestyle changes.
Lifestyle changes. This is a very clear and solid message from Dr. Rajneesh. One food item you tell every fatty liver patient to avoid?
Sweets and sweetened carbonated drinks.
So this is also again very clear advice. One more question was there, you already probably answered. Is black coffee good for fatty liver?
Yes.
Yeah, this is also a clear advice. So this brings us to the end of this very, very interesting and knowledgeable for me as well, the podcast about fatty liver. Dr. Rajneesh has clearly told us what are the reasons for fatty liver, whether is it reversible or not reversible, what food should be consumed, what food should be avoided, and what are the various treatment options available. Remember friends, there are many medicines available for this because it's not the fatty liver that we are targeting, it is the process that has caused fatty liver, and most of the time it is metabolic syndrome, weight gain, obesity, diabetes, and those similar diseases. So, Dr. Rajneesh has clearly mentioned that we have to target weight loss, We need to do exercise. He has told us what foods to avoid, what foods can be consumed, and then few medicines. Dr. Rajneesh, thank you for simplifying everything again. If you have any question related to today's podcast or related to today's topic, you can write it in the comment. Me or Dr. Rajneesh will be very happy to answer those questions. If you want Dr. Rajneesh to discuss any topic related to his branch in future, please do write it in comments. We will be very happy to welcome those suggestions. Viewers, please understand the purpose of this podcast is to increase the health awareness in general population. We are trying to get the information as simplified as possible from the expert in that field. So please do subscribe to the channel. Do share this channel with someone who need to take care of his health, who is suffering from any of the diseases which we have covered in last few episodes, so that not just the patient will be benefited, but their near and dear ones will also understand what care they can take as a patient's relative. This is me and Dr. Rajneesh signing off from today's podcast. Remember, preventive is the best medicine. Take care of your health. Thank you.
Thank you, Dr. Amitabh. Thank you for patient listening. Thank you very much.
Thank you.